Hey, this is Dr. Matheson Harris at Harris Eyelid and Facial Plastic Surgery in Salt Lake City, Utah. I'm just going to give you a short video rundown of what it's like to have pterygium surgery in our office. So for the last several years, we've begun doing pterygium surgery as an outpatient procedure in our office, which can save a lot of money for those of you who don't have insurance coverage for this procedure, which can be very expensive in a surgery center. Our office-based surgical room has a microscope and all the necessary instruments and precautions are taken to make sure the surgery goes well, and we've had very good success. Pterygium is a growth that forms from the conjunctiva, which is the clear skin on the white part of your eye. Usually it forms from the inside corner towards your nose and starts to grow out over the cornea, which is the clear window on the front of your eye. As this extends, it can cause the inner corner of your eye to be constantly red. It can also slowly start to cause changes in your vision, especially worsening astigmatism. The pterygium is removed by first giving you a numbing shot behind the eye, which sounds scary, but people tolerate it very well. This allows the eye to be completely numb and you're able to hold very still. Never had a patient have any problems with keeping still during the surgery. We then begin by removing the head of the pterygium off of the cornea and carefully polish the surface of the cornea so that it will have a clear appearance once it's completely healed. Once we have the pterygium off of the cornea, we can then trim the conjunctiva back so that it goes back to a normal appearance. All of the red areas are removed and the underlying tissue, which is where the inflammation resides, is completely removed as well. The area where we've removed the pterygium then has to have some new tissue placed in there so that you don't get recurrence. This is borrowed from the conjunctiva, or that thin skin on the eye, up underneath the upper eyelid where you won't even see it. We remove a small patch graft and then we place it in the inner corner of the eye where we've removed the pterygium. And this is held in place with a special tissue glue, which allows us to do the surgery without any sutures, which can make the eye much more comfortable in the post-op period. First day after surgery, we have you patch the eye and keep it covered for 24 hours. Then you'll remove the patch at home and begin using antibiotic and steroid eye drops. These continue until the bottle is gone, usually around 2 weeks of drops. At that point, the redness and irritation will be gone. In some patients, the redness can last longer than a few weeks, and we have some patients who end up using more than one bottle of the eye drops. But this will just slowly improve until the surface of the eye returns to a normal appearance, just white with a few small blood vessels like we expect. After surgery, the most common complaints we get are that the eye is scratchy in the first day or so. People can have some pain, and most patients take 1 or 2 pain pills after surgery, but it's usually pretty minimal. Some patients do have a change in their vision because of the amount of astigmatism which was created by the pterygium, and those who are wearing glasses before surgery, in a few small cases, have to have the glasses changed afterwards. Patients who previously were unable to wear contact lenses because of the pterygium very often are able to begin wearing contact lenses again afterwards. The important thing to prevent these from coming back is first to do the surgery properly with a graft. That reduced the recurrence rate from the old type of surgery, which was about 50% recurrence rate, to our current recurrence rate, which is less than 1%. You also should continue to treat any dry eye problems using artificial tears as necessary, and also prevent sun damage to the eye by wearing sunglasses when you're out in bright light. If you have any questions about pterygium surgery or if it's right for you, please give our office a call at 801-264-4420 or go on our website at utahoc.com. Have a nice day.